from the All Indiana Podcast Network. It's Diversity Focus Today. Now, here's your host, Ricky Solid Gold Clark.
Hello, welcome to Diversity Focus Today with Ricky Clark. I'm Dr. Tabby Harris, better known as Dr. T. Ricky Clark is not here today, as well as attorney Michael Murray. But we do have two lovely guests here, as Ricky would say if he was sitting in this seat. First, I'd like to bring to you Dr. Debrah Miller, MD, ABFM, in Obesity Medicine. And then we have Terra Cooks, who's a multi-genre artist, spoken word recording artist, filmmaker, author, and originally from Chicago, but transplanted to Gary. Welcome, ladies. Welcome, ladies. Today's topic is going to range from that of obesity and image in that, and in the current, I guess, what's going on in New York. They had this statue, and the artists, they had, I don't know if you heard about that, the statue of the 12-foot bronze African-American woman that's located in Times Square. It was Thomas J. Price. He was a London-based artist, and this installation is going to be up from April 29th to June 14th. So by the time this airs, it'll be June 8th, so people will still be able to get to see it if they want. But the name of this series is called The Grounded in the Stars. It's a 12-foot tall figurative bronze sculpture of an overweight black woman. And it had a lot of mixed reviews, but mainly negatives, and about the image of how black women were portrayed and that of obesity. And being that you, Dr. Miller, has just recently written an article called The Resistance of Weight Loss. Mm-hmm. And I just wanted to have you in to kind of talk about the image of, obesity and when it comes to African American women and just in general in itself, So
That's
would you mind?
Interesting statement you made, because from my perspective as a healer and a physician, particularly I practice integrative medicine. That is where I understand the conventional medicine as well as what people call Ayurvedic medicine. Together, they help heal people through support, through nutritional support as well. However, I look at obesity as a disease. I find it interesting that had it been some other type of disease, I don't think they necessarily would be showing it as something favorable. I don't think, however, that a statue of an obese woman necessarily represents us. Mm-hmm. I just find it interesting that they chose that particular type of a robust figure. Mm-hmm. So, but then culturally, we have a variety of images that portray obesity as a disease. Of course, if it's a disease, but also people, what I learned after about 20 to 30 years of practicing medicine is that people are not overweight because they're lazy, nor are they overweight because they're greedy. Obesity is a disease, and as such, it should be treated as such. Mm-hmm. For instance, if someone has hypertension, I would make a statue showing that they have hypertension and portray that as some type of advantage or some type of something to glorify.
Right.
So I find that very interesting. And but what we found over time is that as we have learned about obesity and how to treat it, we have been able to develop methods that are very effective in doing so. So I don't particularly think it's effective in portraying anything beneficial.
Right.
In my opinion.
Hence the mixed reviews that they have on
in my
that.
opinion.
So how would you define obesity in itself? What is obesity?
Okay, obesity is an excess of body fat. And as such, we should recognize that when treating it, we have to not only consider body composition, but the things that are going into the body to make it such, to create not only fat but muscle. So I like to think of the body as a chemistry lab and not as a bank. Okay. When I was in medical school, people told me that calories in, calories out, but then after practicing and treating people who tried their best to lose weight, or who tried their best to maintain a healthy body composition, I found that they were very challenged in doing so, nor did I have the tools necessary to help them. Mm-hmm. And so after years of treating people with diabetes, hypertension, heart attacks, strokes, going on and on. And we also know that hyperinsulinemia is related to cancer, particularly breast cancer.
And what's
I'm sorry, could you
And
repeat that
obesity.
again?
Yeah, hyperinsulinemia is
Okay.
is related to breast cancer because we have insulin growth factor that are receptors on the cells of on all healthy cells, all cells, including unhealthy cells. And so sugar is the basis for all growth. If you think
Okay.
of it that way. So the body, so you can stimulate growth in even cancer cells with sugar.
May I ask you a question? So
certainly.
you go by BMI, correct, to determine
Body
whether or
mass
not,
index, that's
okay,
correct.
that
Well,
determines whether or not a person is obese or not.
Absolutely. That is what we tell people, but that is just a guideline. For
Okay.
instance, look at somebody like Ron Artest. Ron Artest, we've all heard of him, right? He's a basketball player. Ron Artest's BMI is 32. We define obesity as a BMI above 30.
Okay.
Is he obese? So we know, of course not. He has a lot of muscle. Muscle weighs more than fat.
Right.
So what we have to understand about when we use these guidelines is that they have to be applied in situations which they are applicable, so to speak. So athletes, for instance, they may be considered obese, but they're not based on that guideline, the BMI. BMI is body mass index, which is a calculated value based upon not only the height and the weight, but also it's a mathematical calculation.
Okay.
And so we use it generally speaking, but it's not what I found to be more effective in dealing with obesity is understanding body composition very well, and also the way that where the fat is. We've got healthy fat and we've got unhealthy fat. And preponderance of unhealthy fat, of course, contributes to diseases such as diabetes, hypertension, stroke, heart attack, and on, particularly cardiovascular diseases. So we call that visceral fat.
So that's around the waist.
That's correct. So one of the second most important number that's on the scale when you look at your weight is your waist circumference. And now I use waist circumference divided by hip circumference, which is a ratio showing the tendency to develop cardiovascular disease.
So is that where the weight is stored when you
That's
or where people carry weight? Because I hear people say, I carry it on my hips, I carry it in.
That's where that's where the fat is stored. That's for ready source of energy.
Okay.
So if you're on a desert island and you're starving, it's going to access that fat first.
Okay. So what's the ideal circumference between the hips and the waist?
Well, it should be less than 0.85 if you're using the ratio waist to hip. You divide. You have a waist and you divide it by the hip measurement in inches, and 0.85 is 0.85 or higher is typically, let's say 0.85 to 1 is considered normal. You can be less than 0.85.
Okay.
But my point is that above that is considered
Over-assessed.
It's considered. It's a good way to assess risk.
Okay.
It's really a value that's used for risk assessment.
So the fat
As is the BMI.
So that means the excess is going into other organs.
It
more
means
so
that
than
it's not where it should be.
where it should be.
Unhealthy fat, for instance, this fat and this fat are two different fats. For instance, if you have a young woman who is a long distance runner, why does she start menstruating? You've heard of that, right? Because she doesn't have any. She's lost her healthy fat.
Really?
And healthy fat is what helps make hormones. For instance, estrogen and progesterone. If you have an imbalance, then women stop menstruating. Okay, so we look at healthy body fat, body composition, where the fat is a good indicator for risk assessment. And why is that important? Risk assessment is important because what good does it do you to have all these numbers if you don't know what they mean as it relates to risk? Okay, so when I look at an excess of body fat, I also, the second number, as I said, that's more important than your weight is your waist circumference, your waist circumference, and the third would be the waist divided by the hips.
Okay.
And that gives you a tendency, that gives you in fact, it's one of the more important indicators in something called metabolic syndrome, which is a collection of not only biological markers, but also a collection of different types of chemical markers. Okay. And so metabolic syndrome is extremely common, and it is a risk factor and very much seen in cardiovascular disease, but associated with diabetes and hyperinsulinemia.
So the young lady, so kind of back up a little bit, the statue of the young lady in New York. I can understand why I get mixed reviews, but my interest in that, based on what you just said, well, everything you said, you could tell that the young lady is at least somewhat overweight based on the way it's modeled. Let's say if she was more toned up and you can tell that she was toned, would you still say she was overweight?
Well,
Like the muscle?
well,
Right.
if she had, for instance, someone can have a very small waist and large hips, and can have a normal waist to hip circumference, and a generally healthy body composition. But that denotes risk, or they decrease in risk for cardiovascular disease in particular.
The hips.
The visceral fat divided by the
Okay.
hips. Okay, but let's look at that picture of her. There are people like Ron Artest, for instance. He's obviously not obese, but he has more muscle than he has. In fact, he has 9% body fat, which is remarkable, really. So when they show a picture like that, if she was more rotund, that is around the waist, then that, of course, she is obese. So obesity is a complex term that's not only defined by body composition and BMI, but a number of things. So it has to be properly applied with the proper demographics. So if you're looking at a group of athletes, you're talking about one thing. Even a babies
fat is
can
good.
look fat, you know.
Right.
But body fat is necessary to also produce hormones to keep a normal body composition, as well as a healthy, what I like to call metabolic milieu of hormones, from anything from cortisol to estrogen to testosterone to insulin, progesterone, on and on. Does that make sense? I hope.
So,
Most definitely.
two questions I'm wondering. People talk about wanting to lose weight. What does that mean to lose weight? And how would you kind of reframe that to help them understand what losing weight consists of?
Well, when I first was in medicine, I would find that people could go on something that they used to call Adipex, and they would lose all this weight. But losing weight is not the issue. What you want to lose is unhealthy body fat. So they interpret it as weight, because when you look at the scale, sure, it's there. But there are people who have an unhealthy body composition who are not healthy. I mean, who are not considered overweight.
So they walk around thinking they're healthy.
Yeah,
and
right.
actually
And
not.
you've seen those
Okay.
people, Pickwickian, for instance, people with large abdomen and small extremities, very thin. Those people have an abnormal body composition, and that's why they call them Pickwickian syndrome, because they also could develop things like sleep apnea. And that was primarily due to the fact that the weight was primarily the wrong distribution, distributed in the wrong place. So what we have is a culture where we are focused on weight and not on healthy body composition or healthy weight. And so we got to understand that weight consists not only of body fat, but also of muscle. We got bone, we have water. We have all these different things that make up our body composition. So people say they want to lose weight, what they mean is they want to look at the scale and see something that's desirable.
Right.
But they don't necessarily. I've had plenty of people that have very small waists, large hips, and they're healthy. And I've had other people that have very big middles. Give you a good example. Someone in my family actually had a BBI, what they call a Brazilian butt lift, right?
BBL?
Brazilian butt lift. Okay, she had hyperinsulinemia and gestational diabetes. Okay, she also had early sleep apnea and hypertension and metabolic syndrome. And metabolic syndrome is hypertension, BMI above 35 in a female and 40 in male. It's also having a elevated triglycerides, a low HDL, which is good cholesterol, and an elevated fasting blood sugar. So when you look, 3 out of 5 of those give you disease, let's say. Okay, so this person decided that they were going to get this fat removed and put it where it was more back here, so they would be cute. Okay, so this person did that until 2 or 3 months after the surgery. Now they still weighed the same, but the fat was in a different place. They took this fat and put it on the butt, nice and cute and shapely. Okay, I went to her birthday party. She looked wonderful. Okay, however, about a month or 2 after that, she was at her work, and she had an elevated blood pressure. Came to my office, blood pressure 200 over something. What's my point? My point is that even though you took the fat and you put it someplace else, it still did what it wasn't supposed to do. That is, it still made you unhealthy. When she lost the fat, And by going on a GLP and several other things that helped her burn fat efficiently, her sleep apnea went away, hypertension went away. Even though she had this fat still produced disease in another place.
Oh,
it was amazing.
Wow.
And it taught me something. It taught me that I had to convince people that body fat is, particularly women who are looking to appear what they consider now attractive, I guess, by putting fat back here. Yeah. But still, that fat, it's not so much where it is, it still produces disease. See? In other words, you put it here, but it still had the tendency to do that. Why? Because of the hormonal connection between that body fat and the adrenals and going on, primarily the pancreas.
So what is the solution? Is it more about exercise, food? How do you create that
even that's what's interesting about weight loss resistance. What I found was that I could give people some Adipex, I could give them a diet, I could have them exercise, I could have them do all these things.
Is that Ozempic, Adipex?
Yes, Adipex is a medication like phentermine that keeps people from being hungry. It acts centrally. It has a mild effect on the metabolism, but more importantly, it acts centrally. A GLP or Ozempic is a medication that changes the way that the body, that the stomach empties, thereby controlling insulin levels.
Okay, insulin level.
Okay, so, and that is your tendency. The higher the insulin level, the more you have in terms of body fat. Okay, so what happens is that as you are able to identify the areas of weight loss resistance. So, give you a good example. I bet everybody in this room who struggled with their weight, including myself, has done everything that was necessary. They went on a diet, exercised, and then they reached a certain point called a plateau and couldn't go any further no matter what they did.
Well, stayed at that number.
They stayed at that number. They said, well, I'm exercising, I'm eating right, I'm taking my water. Other than what's wrong? What I found over time is that there are exactly, or perhaps more, 12 areas of weight loss resistance. That is, the human body or its metabolism is like a universe. You know, it's like the sun's in the middle. I used to think of that as being the thyroid. And then out here, it connected with the pancreas, it connected with the adrenals, it connected with in men, the testicles, and women, the ovaries, etc. But, and if you fool around with anything, that is, the doctor decides to just say change what the insulin level is or control the blood sugars.
Right.
It shifts. That is to maintain balance. The human body does not struggle towards a state of being healthy. It struggles towards a state of being balanced.
Oh, wow.
And so what ends up happening is, as you reach that plateau, you say, now, what's wrong now? So what I found was that if I was able to discover why they plateaued and prevent them, that I could have effective weight loss or fat loss.
So how do you determine their plateau?
You have, well, exactly. I think of it as an onion also. Okay, so when you're
a great teacher. I know. I'm like, can I take your class? And I'm an artist. We're artists, so we can visualize all of this.
Remember, like myself, we had that first baby.
Yeah.
We had all this little body, this little belly fat, and all this stuff we were trying to get rid of. But before that, we had this beautiful little figure, right? And we said, how come I can't get back there? So what I do is, when something happened, as you move towards that perfect body composition, and out here, what I see when you come into my office is a person with sleep apnea. My point is that I have to identify all the different things that have happened, that have happened over your lifetime that have resulted in you becoming difficult for you to burn fat. And if I unravel those things like an onion, peel it away, I can fix it 100% of the time.
I don't think I have ever heard such in-depth.
Yes, this is very
I mean, it's like, are you an anomaly?
Like, where was my doctor?
I'm called a weirdo, that's for sure.
Because even when you talk to nutritionists, they don't go into detail
that's
like
interesting
that.
you would mention that, because what I found is that, think about it, you have nutritionists, but you also have dietitians. What I found when I worked at the Obesity Center at Winona. And we used to have this big argument because they told my patient who was a diabetic to have orange juice for breakfast. And so my patient who was diabetic would have this orange juice because they said, well, what difference does it make? It's calorie count. It's not the calories. It's the composition of the calories. And oftentimes it's the way your body processes them.
So everybody's different when it comes to the
That's right.
processing.
So what would happen is, so I would tell my patients, and we argued about that. So then they came up with something called consistent carbs. There's no such thing in carb counting I disagree with. Because what I found is that you have, at the center of the universe is glucose. And glucose is the source of energy. And you have to figure out how to create glucose efficiently, how to get it into the cell, or where the thyroid's involved, and a number of other things. So so they would give these people orange juice for breakfast, but then I would use this example. I would say, you're in the hospital, your blood sugar drops, what do I give you? Orange juice? Why would I give you that for breakfast if you're diabetic? Although they let you have that. And one of the biggest problems that we face in our culture is the breakfast of champions. I hate to use that example, but everybody wants to have cereal for breakfast. So cereal is a carb, and it immediately turns on your pancreas. Okay, so once your insulin level goes up, insulin hoards fat. That means it forces fat. And if you don't exercise, where do you think it's going to go?
Right, it's going to sit.
That's right. And if you eat late at night, and at late at night you eat, and let's say you have sleep apnea, what happens to your oxygen? It drops. So then what happens to metabolism? Metabolism requires oxygen. So that's another area of weight loss resistance. That's why obese people tend to, more often, or people with sleep apnea, more often than not would be obese, or at least they'll have something that keeps them from getting oxygen to their body. So, my mouth's a little dry, I'm sorry. But so we found areas of weight loss resistance. We had to identify them. And if we didn't have enough oxygen, if we didn't have enough serotonin, testosterone, progesterone, estrogen imbalance, thyroid.
Oh, wow. It's like the 12 areas you spoke of earlier.
Yeah, mitochondrial dysfunction, hyperinsulinemia, prediabetes, on and on and on. And thank you. You can identify. Sorry. You can identify these things, and oftentimes, what we would find is that, for instance, people with fibromyalgia, why do they tend to be obese? Well, because they don't sleep well. It's a form of sleep deprivation. And if you don't sleep, we know one thing. We don't know why, but we do know that people with sleep disorders tend to have problems or damaged metabolism.
So it's the, I'm sorry.
Not just because the tendency to have sleep apnea,
the weight,
an inherent reason.
Is the weight the symptom from everything else, or the symptom the everything else is the symptom for weight?
The weight is a combination of the.
It touches seem like in everything.
It does, and that's why I had to change what I did.
Oh wow!
Because what good did it do me to give people a bunch of medication, and I got kind of tired of giving people a bunch of medications that only treated the symptoms. So so then when I decided to start doing obesity, I looked at it, I said, why am I treating blood sugars? The blood sugar is an indication of a dysfunctional pancreas. I should be treating the pancreas, and then the blood sugars are actually being absorbed by the cells. What happens if I have insulin resistance? What's wrong with the cellular structure? Now I gotta understand thyroid. I gotta have oxygen to do it. It gets fascinating.
It is very
really
fascinating.
is.
So basically, when you mentioned the metabolism and the oxygen, basically if you're not getting enough oxygen, your metabolism drops, and therefore you're not able to process everything you need to process you need to process
That's
it.
right.
And it stores.
I tell people that have sleep apnea, I don't have sleep apnea. It's not just sleep apnea. Sleep apnea is a long endpoint on a continuum of hypoxemia.
Right.
So it can be like diabetes. You can be a diabetic that's insulin or that is diet control versus one that's on an insulin pump. It's a continuum. So it's low oxygen at night produces a problem with metabolism.
Wow.
And that's why it's so important to treat sleep apnea. Because, so that's one of the things. So I would find over time that as we adjusted the different areas of weight loss resistance, whether it be oxygen deprivation, and I left out ineffective lifestyle. People say, well, what about exercise? Exercise is a drug. It's extremely necessary not only to increase endorphins and a feeling of well-being, but it also it increases insulin uptake at the cellular level, and therefore it increases Why do you think doctors used to give people B12? B12 is one of the cofactors on the Krebs cycle that helps produce energy. So when you get B12, you say, oh, I feel so much better. Well, that's because it went right to that Krebs, helped you metabolize glucose. Glucose got to the cell, and you say, oh, I feel great.
Great. Okay.
And we were mentioning vitamin D, and vitamin D is essential as well.
Yeah.
You are such a wealth of information in so little time. So I know people watching are going to want to know how to get in touch with
That's
you.
what I was wondering. Like,
You can just reach out and touch.
from Gary, Indiana, right? Chicagoland.
Well, I'm at Mapleton Center for Health, Fitness, and Nutrition, which is, we've been there since I've been there since 1988 on 34th in Pennsylvania at the Mapleton Medical Center. I am the medical director, and we also have a fitness area as well. And so it's a lot of fun. I just love, because it's fulfilling, it's rewarding, patients get better, and see, more importantly, when you talked about losing weight, see, people just want to look better, but see, in the end, you got to feel better.
Feel better.
Right.
I like that.
And you've got to be able to keep it off and not gain it back, because if you lose it too quickly, what happens? When you lose weight too quickly, the body starts catabolizing. That is, it starts breaking down muscle.
Wow.
And muscle burns what? Fat. Now you've got decreased glucose uptake at the cellular level, and now it slows down, and now you've got less muscle. You altered your body composition, and now you don't burn as much fat.
I
Thank
can definitely, because I recently lost 27 pounds and working on losing more, but I feel so much better.
That's right.
You know, since I lost it, and it's like, I'm still trying to get back to the pre-baby weight, but I'm
And
not
you
sure that's
can.
reality.
You know why? See, we make people that are obese
Feel.
or overweight, even overweight, we make them feel guilty.
Yeah.
And what I learned is that, that guilt-ridden stuff doesn't work, because I found out myself that
So,
anybody that walks through my door to lose weight or to
Right.
lose body fat,
right.
they are not, I tell you, you're not overweight because you're greedy and lazy.
Okay.
It just
We're
isn't.
gonna,
Anyway.
Yeah. Wrapping it up. Thank you. This is on
There's
again.
so much that we could talk about on that.
But
you know,
we got a phone number real quick that we can
yes.
say?
Eric, 317-924-4545.
You can say one more time, as Ricky would say.
Area code 317-924-4545, the Mapleton Center for Health, Fitness, Nutrition, Mapleton Medical Center.
Thank you.
Thank you.
Thank you. But I'm quite sure it's a lot about teens and adults, and like I say, our culture, African Americans, about weight loss that's historic with food and exercise. But I definitely appreciate you being here. And your one final word with advice would be?
If you're interested in being healthy, more healthy, and you're interested in losing those unwanted pounds, seek a specialist.
There we go.
Seek someone who understands that, because those shots are, interestingly enough, that's not the only way to help burn fat.
Thank you. Thank you.
Yeah.
Thank you.